Welcome to the PureBMC SupraPhysiologic processing video for the 120 milliliter concentrating system. In this video, we will demonstrate how to process 120 milliliters of bone marrow concentrate. We will begin by priming the bone marrow needle and filter. Use heparin solution 1,000 units per milliliter as the anticoagulant of choice. If heparin is not available, you may also use citrate as an alternative anticoagulant. Start by aspirating 20 milliliters of heparin into the 60 milliliter syringe. Remove the stylet from the bone marrow needle and prime the needle. Then, reinsert the stylet. Next, connect the heparin syringe to the out port of the BMA filter and prime the filter by injecting and removing the anticoagulant. Now use a female-to-female connector and transfer the heparin into 4 30 milliliter syringes. Leave 2.5 milliliters of heparin in each syringe. Using standard technique, aspirate bone marrow into each 30 milliliter syringe, filling all 4 syringes to 30 milliliters. Connect each 30 milliliter bone marrow syringe to the in port of the bone marrow filter. Then, connect a 60 milliliter syringe to the out port of the filter. Filter by injecting bone marrow from each 30 milliliter syringe through the filter into the 60 milliliter syringe. Repeat this process with another 60 milliliter syringe. Ensure the vent lid is in the open position. As a mandatory step, always clean the ports with sterile alcohol before and after accessing them with a sterile syringe or cap. Attach the clear, non-vented cap to the bottom port prior to centrifugation. Now, attach the 60 milliliter bone marrow syringe to the top port of each device. Slowly inject the bone marrow into each device. Once completed, close the vent. Each device should counterbalance each other with equal volume. Place both devices in the centrifuge rotor at opposite ends. Follow the protocol settings provided in the IFU insert. Close the centrifuge lid and press start. After centrifugation, attach the sterile syringe accessory to the needleless port and aspirate the bone marrow plasma suspension. Then, open the stopcock to the 3 milliliter syringe and aspirate 2 milliliters of red blood cells. Transfer the aspirated solution into the concentrator device as shown. Inject the bone marrow red blood cells first, followed by the bone marrow plasma suspension. Repeat this process for the second device. As a mandatory step, always attach the clear non-vented cap to the bottom port prior to centrifugation. Place the devices back into the centrifuge rotor at opposite ends. Follow the protocol settings provided in the IFU insert. Close the centrifuge lid and press start. After centrifugation, the bone marrow buffy coat layer will be clearly visible at the bottom of each device. Remove the clear non-vented cap from the bottom port of each device and attach a sterile syringe. Aspirate the plasma, leaving 7 milliliters of solution in each device. Resuspend the cell concentrate back into the plasma by gently rocking and swirling the device back and forth. Continue this until all the concentrate has been resuspended into the plasma and is no longer visible at the bottom of the device. Attach a 20 milliliter syringe to the needleless port of each device and tilt the device to aspirate the bone marrow concentrate. This concludes our processing video.